Introduction of clinical pathology. Pathology is study of disease processes with the aim of understanding their nature and causes. This is achieved by observing blood, urine, feces, and disease tissue obtained from living patients or at autopsy by the use of X-ray and many other techniques. These techniques are studied under the clinical pathology. Clinical pathology is thus the application of knowledge gained to the treatment of the patient. The great human pathologist Rudolf Virchow is the father of pathology. Clinical pathology is the key subject in the study of paramedical science. It forms the bridge between the preclinical science of anatomy, physiology, and biochemistry on one hand, and clinical branches of medical and surgical discipline on the other hand. The study of pathology is divided into two parts. Clinical general pathology. It deals with the general principles of disease. It is related to whole body. The systemic pathology. It is a study of disease related to the specific organs of the body system. The terminology in pathology. Health is the condition when individual is complete according to the surroundings. It is a state of complete physical, mental, and social well-being. Disease, feeling of uneasy. The state of discomfort of the body is disease. The patient is the person affected by the disease. Pathology. Patho means disease. Logy, study. Pathology is the study of disease. Scientific study of disease. Symptoms are those which are narrated by the patient and his relatives. Signs are those which are observed by clinicians or physicians. Etiology. It is the causal factor responsible for the formation of disease. Pathogenesis. The mechanism by which the disease is produced is termed pathogenesis. The laboratory plays a crucial role in the diagnosis of disease and therapeutic management of the patient. The clinician depends upon the laboratory for its diagnosis of the disease. The diagnosis of the disease involves the examination of the specimen collection from the patient, which includes urine, stool, sputum, blood, cellular CSF, other body exudate, and biopsy material. The diagnostic test of these specimens are carried out in the laboratory. Blood. Hematology is the study of blood and its different components. The hematology laboratory routinely reports number of cells in the blood, hemoglobin concentration or ESR, and PCV. Blood is a red vascular connective tissue. It forms 6 to 10% of body weight. Generally 90 ml per kilogram of blood is present in human body. It is somewhat sticky and slightly heavier than water. It is slightly alkaline, having pH 7.4. The blood transport vital requirement and waste products of the body. Blood consists of two types of components: A, blood cells and plasma. Blood is divided into blood cells and fluid part plasma. Blood cell is divided into RBC or erythrocyte, WBC or leukocyte, and platelets or thrombocyte. Blood cells. There are three types of blood cells: RBC, red blood cells, corpuscles or erythrocyte; WBC, the white blood cells. There are three types of blood cells: RBC, red blood cells, corpuscles or erythrocyte; WBC, white blood cells, corpuscles or leukocyte; platelets or thrombocytes. Erythrocytes are red blood cells. They are biconcave, non-nucleated, disc-like cells. The central area is thin while edges are thick. The edges contains hemoglobin, which transport respiratory gases, that is oxygen and carbon dioxide. The shape varies flexibility for absorption and releasing gases quickly. The size of the RBC is 7.2 micron. In a matured male, about 5 to 5.5 million cubic millimeter of blood, and in female about 4 to 4.5 million per cubic millimeter of blood are present. The life period of RBC is about 90 to 120 days. Leukocytes. These are colorless nucleated cells. Normally 4,000 to 11,000 WBC per cubic millimeter of blood are present. There are two different types of WBC classified on the basis of presence of granules in their cytoplasm: granulocyte and agranulocyte. These are characterized by the presence of granules in their cytoplasm. These cells are produced in the bone marrow. The granules are classified on the basis of the shape of the nucleus and the dye which they take. They are neutrophil, basophil, and eosinophil. Neutrophil is also known as a polymorph or macrophages. There are about 65 to 70% of neutrophils present of total WBC. The cytoplasm is full of granules that picks up both acidic as well as basic dyes. The nuclei has about 3 to 5 lobes connected by a chromatin strand or thread. The life period of neutrophil is about 3 to 5 days. It is large cell having a diameter of 12 to 14 meter. The neutrophils are phagocytic in nature. Basophil, the cytoplasm of the basophil contains a small rounded granules which takes up a basic stain. The size is somewhat small with a diameter of 8 to 10 micron. The nucleus is usually kidney shaped or slightly lobulated. The cytoplasmic granules are central and overlap the nucleus. The life period of basophil is 8 to 12 days. Normally, about 0.0052 to 1% basophils are present. Basophil secretes a chemical substance known as a heparin, which prevents the clotting of blood inside the blood vessels. Eosinophil, or also known as a bilobed cells, as nucleus contains two lobes connected with the chromatin strand. It picks up the acidic stain. These are circular in shape with a diameter 10 to 12 micron, normally about 15 to 400 cells, that is about 1 to 6% of blood is present. The life period of eosinophil is 8 to 10 days. It protects the body by releasing a chemical substance called histamine. Histamine set off a chain of reactions that ultimately leads to an inflammatory response at the site of infection. Therefore, in case of allergy condition, the number of eosinophil increases. A granulocyte. These are characterized by the absence of granules in the cytoplasm. These cells are manufactured by lymph gland and spleen. These are of two types: lymphocytes, monocytes. Lymphocytes. There are two types of lymphocytes on the basis of area of cytoplasm. The small lymphocytes. In small lymphocyte, the nucleus is relatively large in size and round in shape, which occupies a major part of the cell, leaving behind a small cytoplasmic area. The diameter of the cell is 8 to 10 micron. It is about 50% of total WBC at the time of birth. The number decreases with age. At the age of 10 to 15, it is 35%, and in adult, it is 20 to 30% of total cell. The life period of small lymphocyte is very short, less than 24 hours. It is produces antibody. The large lymphocyte. The diameter of large lymphocyte is about 15 to 18 micron. Then the nucleus is a centrally placed, small, round in shape, leaving behind a large cytoplasmic area. There are about a 5 to 10% large lymphocyte present in adult. However, the number is more in children. The life period of a large lymphocyte is small, about a few hours. It produces antibody. Monocyte is the largest of all WBC, having diameter 15 to 18 micron. The nucleus is kidney shaped. It can be differentiated from basophil, as nucleus of monocyte is eccentric. The monocyte are about 2 to 6% of total WBC, that is about 100 to 600 per cubic millimeter. The life period of monocyte is about 1 to 2 days. The monocyte are phagocytic in nature. Structure of WBC: granular, granular neutrophil, eosinophil, basophil, granular lymphocyte, monocyte, and lymphocyte, small lymphocyte, large lymphocyte. Platelets or thrombocytes. These are the smallest of all blood cells. Platelets are spindle-shaped cells having a diameter 2 to 3 micron. These are also known as a thrombocyte, along with another coagulation factor. It helps in process of clotting of blood. The thrombocytes are having very short lifespan. It is few hours. Normally 1.5 to 4 lakhs platelets per cubic millimeter of blood are present. These are non-nucleated cells containing very fine granules. Plasma. The plasma or liquid fluid part of the blood. It contains about 90 to 91% of water. The plasma contains fats, sugars, various proteins, and hormones. Inorganic components of plasma includes phosphate, sulfate, sodium chloride, sodium carbonate, magnesium. These are dissolved in water. The organic components of plasma includes albumin, fibrinogen, globulin, etc. The plasma also contains digestive nutrients like glucose, fatty acids, glycerol, and calcium. The excretory substances like urea, uric acid are also present in plasma. The other substances present in plasma includes antigen, antibody, vitamins. The chemical composition of the plasma is not constant because continuous exchange of various substances from the plasma to different organs is going on. In this way, plasma is acting as a transport medium in the body. Function of blood: transport of oxygen from the lungs to the tissue and of carbon dioxide from the tissue to the lungs. Transport of metabolic waste of lungs, kidney, skin, and intestine for removal. Maintenance of normal acid-base balance. Transport of absorbed fatty acid, monosaccharide, and amino acids. The regulation of water balance. Regulation of body temperature. Transport of hormones, vitamins, and salts, which contains cations such as sodium, potassium, calcium, and anions such as chloride, phosphate, sulfate, and carbonate. transport of metabolite, defense against infection by which white cell and by antibody to stop bleeding by clotting.